conversation, because we do need to ourselves about where we are and what is the status of women and girls currently in Nigeria and vulnerable persons, and it's quite important to do that. So I welcome all of you, and now I believe the organization and foundation that supported this research and that made it possible is here. So I'm just going to tell you a little bit about that. So at the beginning of COVID, it was Chitra, who is our lead researcher, myself, and Azina from Tears, just started having conversations, and we had written a policy paper, which was Chitra, Shamimper, and I had written a policy paper just talking about, well, Chitra was the lead in also writing that about integrating gender into the COVID response. And GBV was one of the big issues we wanted to make sure that was highlighted. And over the course of the months as COVID happened, we realized that the response wasn't as strong and wasn't as robust as we wanted. And we thought this would be important to continue to do research around how gender is integrated into the response and to the recovery. And the Open Society for West Africa was really interested in this and have been critical to ensuring that there's a conversation and a response around it. And so they were willing to support this research. So Chitra, Education as a Vaccine, which I work for, and Tears, the Initiative for Equal Rights, decided that we would work together to bring this research to life. And so today we want to launch the report that violence against women and girls. We would have more coming in the future, which you should be looking forward to, which we will talk about later. But just to jump into today, we're going to launch the report. We will present the report. We would have a panel discussion about what has been happening in terms of the state of emergency, and also have a little bit of a conversation around what we need to do and how we need to move forward to make sure we don't miss this very critical opportunity to push for change. I'm really, really honored and excited to have worked with Chitra and Tears on this work and to continue the work. Really grateful to Open Society West Africa for being willing to do this work with us. Really excited that we were able to partner with the State of Emergency Coalition to be able to push this forward, and we had a press conference today. Really, really excited and honored that Erelu Bisi-Fayemi, the First Lady of Ekiti State, is willing to participate in this event and be part of this very important conversation, because she's been a leader in this space for many years. I can't wait to introduce her and for all of you to get a chance to listen to her speak. We're also honored that the Solicitor General of the Federation also wants to participate in this conversation as well, and to share about what they've been doing with the Interministerial Committee. So without further ado, let's jump into the event. So I'm going to call on Mikang. I'm going to call on Mikang from Open Society West Africa to just give us a few welcome remarks before we jump to the presentation. Mikang, are you here?
Yes, I'm here. Good afternoon. Buki, can you hear me? Can everyone hear me? Hello?
Yes, we can hear you now.
Yes, we can hear you.
Yes, we can hear you loud and clear.
Excellent. Good afternoon, everyone. My name is Mikang Longjan. I work with the Open Society Initiative for West Africa. I'm very delighted to be part of this historic day as far as I'm concerned. I mean, the launch of this policy brief is a big thing. It's something that we need. And we're so glad that we have partners who have been willing to produce such a policy brief. In terms of WOSIWA, one of our key priority areas has been working on issues on gender-based violence. We have quite a number of projects we've been working on, especially in the last couple of months with the advent of the COVID-19. We saw a glaring increase in violence against women in the country. We've supported many initiatives that focus on that. Just last week, there was the launch of the Unsolved digital platform, which was spearheaded by the National Human Rights Commission. It had a mix of CSOs and government actors in that. And for us, it's a platform for survivors of gender-based violence that they can look up to. We've worked with many other partners who are doing several interesting work on gender-based violence issues. Also, I mean, just for instance, we also work with this. We also work with the states as well. I'm so sorry. I'm so sorry. My son is crying. He had a little incident. Sorry.
And this is all part of the care work.
I apologize, but really, just to round off, we're very proud of our partners, Buki and the entire team for producing this, for this launch. We're proud of Choma and the entire state of emergency group on SGBV for everything they've been able to do. To all the participants, the panelists, the organizers, thank you so much on behalf of the Open Society Initiative for West Africa, and I wish us all fruitful deliberations during this launch. Thank you so much.
Thank you so much, Mikang. And thanks again for your continued support. Okay, so we can make sure we're taking advantage of time. Welcome everybody if you're just joining. I'm going to now hand over to Chitra, who's going to present this report that we've been mentioning and discussing and talking about. So we'll have her present and then we can go from there. Please go ahead, Chitra.
Thank you very much, Buki. I stand by all existing protocols. It's my pleasure to be with you all here this afternoon. Before I start, let me just make the point that this report, this briefing paper, was based on conversations that I had with people working in government, people working for violence against women and girls services, women's rights activists, civil society activists. So I want to thank everybody who spoke to me for this paper. Many of you are here today. And I also want to thank everybody working on violence against women and girls in Nigeria, civil society, women human rights defenders, people working for MDAs and donors. We know that the past few months have been very challenging. And I've been very heartened by the conversations that have been happening around this subject in Nigeria. If you told me, I think even at the beginning of the year, that the Nigerian Governors Forum would have declared a state of emergency on gender-based violence, I would have said that you're dreaming, but look at what came to pass, and it's really down to the efforts of many people who are here today. But now I think we really need to think about how we can translate this increased awareness into action. And this paper, it's not completely comprehensive. I think one day we'll do a real in-depth research into looking at what happened during this pandemic when it comes to violence against women and girls. But it does present the key dynamics that we can see. And so what I will do over the time allotted to me is present the key trends and patterns on violence against women and girls, talk a little bit about the response that has happened to date, whether that's when it comes to provision of services, when it comes to prevention, or the response of the federal and state governments. And then I'll end with recommendations. So I think the summary here when it comes to trends and patterns is that already epidemic levels of violence against women and girls have sharply risen during the pandemic. And I think many of us know the situation in Nigeria before the pandemic, the levels of people who had experienced all different forms of gender-based violence. 1 in 4 girls experienced sexual violence before 18. 17% of girls and women under the age of 50 experience physical and or sexual violence from their intimate partners at least once. Very high rates of early marriage, particularly in the Northwest and the Northeast, whereas we have high rates of female genital mutilation, cutting in the southern part, particularly the Southwest of the country. Now, during COVID-19, we saw a sharp rise very early on, and UN Women did a collection of reports from states, that showed a 56% of increase in reporting during just the first 2 weeks of the lockdown restrictions. And I think we can broadly say that although there is more evidence for some forms of violence as opposed to others, in general, all forms of violence against women and girls have increased. When we look at intimate partner violence, it's more likely, it's more frequent, and it's more severe. And many of the drivers that we know from research that make intimate partner violence more likely have increased during this time, whether this is poverty, food insecurity, tensions within the household, mental health issues, or men's inability to meet gender norms of being breadwinners. What we've seen during this time is both women being subject to violence for the first time from their husbands and boyfriends, but also when they were being subjected to violence before, this has increased during the period of the restrictions. Women and girls are trapped in abusive homes, which also increases the likelihood and frequency of violence and gives them no respite. And when it comes to certain groups, for example, women and girls with disabilities, abusive partners and caregivers have more control over them, and they're less able to leave abusive situations. And at the same time, of course, we're not just talking about relationships between men and women here, and we have some indication that reports of violence in same-sex homosexual relationships have also increased sharply. And if you look at the number of reports to tears, they increased by 87% during the period of the most extreme lockdown measures. We've also seen a rise in violence against girls. Although we don't have too much data when it comes to increased physical violence against children, it's likely that this has increased due to higher levels of stress. There are also indications that levels of early enforced marriage and female genital mutilation and cutting have increased during this period. And of course, girls have experienced sexual violence in the home, in the neighborhood, in worship places, in IDP camps, committed by perpetrators of all ages, socioeconomic classes, and ethnic and religious backgrounds. And indeed, it was the sexual violence which really caused the outrage, which has led to increased attention being placed onto this issue. We see not just sexual violence against girls, however, but also increased sexual violence against women. Now, we know that marital rape is quite a controversial issue in society, but there's been women leaders in communities report more women coming to them to complain about their husbands forcing them to have sex. We've also seen cases of husbands using the threat of divorce to coerce women into having sex. There have been a number of cases of corrective rape of lesbians and bisexual women reported. And I know that same-sex relationships is an issue on which many people have differing opinions, but I think we can all agree that women being raped in order to change their sexuality is wrong. And unfortunately, in all the cases that were reported, the women who were raped believed that this rape had been organized by their families. So in this case, you have family members, parents, organizing the rape of their daughters in order to change their sexuality. And this period of the pandemic has seen more cases of that. Can I please ask that people put themselves on mute so we don't have extra noise? But at the same time, we've seen increased levels of sexual exploitation, particularly in the amongst displaced communities in Northeast, Northwest, and North Central parts of Nigeria because of increased economic hardship that women are experiencing, as well as increased power of men over women and girls. Another dynamic which has not actually been much discussed in public fora, when it comes to violence during the pandemics is the social exclusion, neglect, and abuse of people with disabilities. And during the pandemic, their access to services, to support structures, and to social networks have decreased. They're at risk of stigmatization and potentially being linked to having COVID-19 because of the stress that their caregivers are under. Disability rights activists say that they're less attentive and more neglectful. And as a result, people with disabilities are more likely to have decreased social life, be rejected, and be shunned. And we have very important evidence from the Ebola pandemic in Liberia, Guinea, and Sierra Leone a few years ago, which really showed very high levels of social exclusion of people with disabilities during the pandemic. And I would really urge us to pay more attention to this, this issue. I've spoken a bit before about LGBTQI people, that's lesbian, gay, bisexual, transgender, and queer and intersex people. And during this period, they've experienced more verbal and physical abuse with their families. They've been thrown out and made homeless by their parents who've discovered their sexuality during or gender identity during this time. They've been forced to stay with abusive partners or ex-partners and have been blackmailed, beaten, and threatened, including threats of being killed from family members. At the same time, we've seen an increased rise in rates of unsafe abortion. And this is because, not just because of sexual violence, but because families are less buoyant. It's harder to access contraceptives due to movement restrictions, unavailability of transport, people not wanting to go to health centers because of fears of contracting COVID-19. And we already know that unsafe abortion is one of the main causes of maternal mortality in Nigeria. And unfortunately, these figures are set to climb further still. And one health provider who I spoke to spoke about a 2 times increase in the number of women and girls coming to health clinics for post-abortion care. And she also said that this was likely to be underestimation of the increase in numbers of women and girls turning to unsafe abortion, because many women and girls were not able to go into the clinics. We've also seen theft, robbery, and violence in public spaces that have particularly affected women and girls, especially market women and women hawkers and girls who hawk as well, who are at more risk of theft and robbery, partly because they're more likely to be in public spaces because that's the way that they earn their livelihood, but also because they're seen as a soft target. At the same time, we have sex workers who've experienced significant levels of violence in public spaces. They've been pushed into selling sex in more precarious and dangerous ways that puts them at an increased risk. And at the same time, we have higher levels of street harassment and abuse against people who don't fit gender stereotypes of dressing. Of course, we also know that this period has seen quite a number of cases of extortion and police and violence committed by the police, targeted especially at women and girls who are selling in public spaces, as well as men who are driving keke napeps or okadas. We've had cases of survivors of gender-based violence being held in detention and money extorted from them. We've also had a number of cases where police officers have engaged in so-called contact tracing of lesbian, gay, and bisexual people. So arresting somebody, questioning them, searching their phone, and forcing them to give the names of other people, and then blackmailing and extorting money from them. This period has seen not just violence offline, but also violence online. And so especially people who work with young people talked about an increase in cyberbullying, internet attacks and slut shaming of women and girls, as relationships between unmarried couples break down because of the pandemic stress. There's been an increased sharing of intimate photos, messages, and videos, and also entrapment of LGBTQI people. And the final dynamic that I want to mention here is what is happening when it comes to women human rights defenders. Now, women human rights defenders, because really they've been on the forefront of responding to incidents of violence against women and girls, particularly at a time where the police were really focused on policing pandemic restrictions and were not able to respond to cases reported to them. As a result, they've been at increased risk. And this is not just the physical risk of attending to cases, but also the threats and insults and trolling they've experienced online and offline, which not only is a security risk in and of itself, but it also significantly affected the mental health of people and their ability to do their work. Can I please ask that people put themselves on mute? Thank you. I'm now going to go on to talk about the response to these trends that we've seen. And I think we can say largely that response has been hampered. It's been in large part missing, and violence against women and girls was not prioritized, particularly in the early days of COVID-19. Now we know that services had significant caps even before the pandemic. These have been exacerbated because of COVID-19, with many shelters either closing their doors or becoming isolation centers, counseling moving online, which is good because it has enabled continuity of service. But obviously this has implications for confidentiality of discussions, particularly for women and girls who don't have access to their phones or who don't have access to private places. Survivors have found health services less welcoming and accessible, partly because there's this fear of going to health clinics because of the pandemic. And I spoke to sexual assault referral centers who said that they'd received people calling them to report violence, but once they said that they had to come to the hospital, which is where the sexual assault referral center is based, people didn't want to come there because they were afraid of either catching COVID or being tested for COVID, testing positive and having to isolate in an isolation center. I mentioned earlier about the police being more focused on monitoring restrictions rather than responding to gender-based violence. We've also seen significant delays when it comes to court processes. And we know that we have delayed court processes for violence against women and girls. And that's one of the reasons why many survivors drop out of the case. These cases have been delayed even further. In some states, courts have moved online, but obviously this has implications both for the survivor in presenting testimony online is very different from doing so in person. And in general, services, we've seen significant delays in response when it comes to service provision. And this is partly because services are completely overrun. They see increased demand, but actually not just that it's no additional resources, but resources have actually decreased. We've also seen movement restrictions that service providers have faced because VOG services were not considered essential services at the start of the pandemic. And although there has been statements and saying that these services are essential services and people working for them have received passes, we've still seen cases of women responding to violence against women and girls being detained by the police despite having a pass. At the same time, services have had to put in place contingency plans and mitigation measures to address the risk of infection. When it comes to disability inclusion, services this is a real gap. And so many women and girls with disabilities don't even know that there are places that they can get help, let alone being helped to access them. And we've seen greater barriers to reporting across the board. Now, when it comes to action on preventing violence, unfortunately, there's been hardly anything during this time. And I mean, in general, current efforts in Nigeria on prevention are not really based on clear evidence and theories of change. And there's a lack of understanding of what works. So there's this idea that what we need to prevent violence is to prosecute people, to punish offenders, but there's no evidence that this leads to deterrence. Many people also put sensitization or engagement with religious and traditional leaders as a form of prevention. And again, this has very little impact that we know of. This is not measured. And in general, there's a low awareness of the body of knowledge that does exist on what works to prevent violence against women and girls. I mean, understandably, during this period, there's been real focus on outreach and response, but I do think that there needs to be more discussion on what prevention during a pandemic looks like. I always say the best thing to do sorry, please switch off. Please put yourself on mute. Thank you. It's good to make sure that we have strong services, but it's even better to make sure that we have interventions to prevent the violence happening in the first place. Now, I know that, please put yourself on mute. I think this is the 4th time I'm asking now. Could everyone please put themselves on mute? Thank you. Now, we know that there have been a number of actions by government entities in the last few months, but I think the pandemic has really exposed the widespread inattention and lack of action given to violence against women and girls. There was no integration of the reality that levels of gender-based violence would increase in pandemic preparations. And unfortunately, I would say this is really still the case. And we know that there's uneven capacity across MDAs. So some examples of this are inconsistent use of standards and protocols, even when they exist, survivors being stigmatized, refused treatment without having a police report, being pushed to settled, many health services and courts not being survivor-centered, many community leaders unfortunately hindering rather than enabling access to justice, a focus on sexual violence against children outside marriage rather than the full spectrum of violence against women and girls, and a real missing gap when it comes to prevention. And one of the key ways that we can see this play out really is when we look at the states which have and have not domesticated relevant legislation, whether that's the Violence Against Persons Prohibition Act, the Child Rights Act, the Access to Criminal Justice Act, or the Anti-Disability Discrimination Law that was passed in 2015. And we actually don't have as much information as to what's happening around the nation as we need. And this is partly due to a lack of systematic processes for data collection and analysis. But saying all of that, I do think that we are now seeing an opportunity for change. We've seen violence against women and girls going up the national agenda. We've seen real statements and action by the National Assembly, the governors, the presidency, the Ministry of Justice, and that's really to be commended. But now we need to think about how we can take this forward to actually change the situation on the ground. And the briefing paper actually has a number of recommendations broken down by the actors, but I'm just going to give a brief summary. I think since it's been a few months since the resolutions were passed by the National Assembly and the declaration of a state of emergency, it would be really good for MDAs to report on the progress that they've made during the last few months. We really need to push for domestication of the legislation that serves as a foundation for action on gender-based violence. There's a problem with lack of women's representation and a lack of integration of gender analysis into the Presidential and State Task Force on COVID-19. And so we really need to make sure that the Ministry of Women's Affairs and women's rights organizations are included in these decision-making spaces. We need to think of what the state can do, not just to respond to and prevent violence against women and girls committed by the general public, but also that committed by security agents. And here we really need the implementation of a zero tolerance policy for violence committed by security agents. We need proper funding for interventions on violence against women and girls. We need to be more inclusive of survivors with disabilities, and particularly working with women-headed disabled people's organizations to make this happen. We need to look at the data issue. There's lots that we should do to make services more survivor-centered, whether that's training people how to interact with survivors, or actually, and also how to carry out investigation, whether that's police investigation or clinical investigations. I know we have the Solicitor General here, and I would really recommend this particular point to him. There is a need for a special court on gender-based violence to deal with some of the access to justice issues that we're having. I think Lagos is a good example of this, and we would really urge for this to be scaled up to other states. There's a gap when it comes to protection of victims and witnesses, and we've seen in many cases them being threatened by the perpetrator and his family. And so we really need a victim and witness protection program, as well as training community leaders on gender, human rights, and violence. I would also say the last 2 points are really important, which is about improving knowledge and shifting attitudes on violence, and also looking at the way that the media reports violence, and developing guidelines on reporting and training and editors on them. And I will finish there. Thank you so much for your attention. And I'm really looking forward to the panel discussion and to the questions afterwards. Thank you. Buki, are you still there?
Okay, thank you so much, Chitra, for the presentation. Yes, sorry, hope everyone can hear me. I've been using both my phone and my computer because the internet has been really bad and it just started raining. So hopefully it's fine on your end. Great. I just really want to say thank you again to Chitra for the presentation, and then also to say that I know that people will have questions and possibly comments, but we want to jump straight to the panel discussion first. Before we start, let me stop my video, maybe that would help. Before we take questions, so that we can at least get some information and feedback in terms of that, before we then jump into questions. But so that you don't forget your question, please, you can put it on the chat. We will start to collate it. So if you have questions, comment, please start to put it on the chat, because there will be time for it afterwards as well. I really just want to recognize, before I call on our distinguished panelists, I'm so excited to hear from them, but I do want to recognize the presence of Her Excellency, Mrs. Bamidele Abiodun, the First Lady of Ogun State. Thank you so much, ma'am, for joining us and being part of this conversation. It goes to show how committed you are to this work. And so now it's time to just jump straight into the panel discussion, and we have amazing guest with us. I really just want to welcome Mr. Adedayo Akpata-San, the Solicitor General of the Federation, who is here with us. He had been trying to join and internet was trying to work against us, but he kept going. So I'm really grateful, sir, that you kept at it. We're really glad that you could be here to talk to us. And we know in terms of the commitment of the Ministry of Justice, as Chitra mentioned, in terms of the Interministerial Committee. So we look forward to hearing from you. I was looking through your work in your bio, and one of the things that really stood out to me was the fact that you facilitated a lot of reforms in the areas of administration of justice, in capacity building, and staff welfare. So we know we have a champion and a partner in you. So welcome and thank you for being here with us. I also want to call on someone who I really respect, and I'm really grateful that she made the time to be part of this and has been someone we've looked up to in the feminist movement in Nigeria. I know a lot of people want to say, is there a feminist movement in Nigeria? But I promise you, there is one, and Erelubisi Adele Efayemi is a critical part of that story and a critical part of that history and that work. She is currently the First Lady of Ekiti State, and like I said, she's a feminist, no ifs or buts, which I love. About her, I could spend 10 hours reading her entire bio, but I do think you should go to Wikipedia and look her up. You should definitely know that she co-founded the African Women Development Fund. She also has this really great platform for women called Above Whispers that has a lot of information, just writing about feminism, about life, about gender. So it's worth you go looking at the platform, and also just the amazing work she's done in terms of pushing the agenda in terms of fighting against gender and sexual-based violence across Nigeria, but especially in Ekiti State as a First Lady. And she's of course the chair of the GBV Law Management Committee, and they've done some amazing things. So I'm not going to put words in her mouth, but I'm going to let her be the one to tell us. And she's of course the chair of the governor's White Forum that was really critical to also pushing for the state of emergency. So we're really glad to have her here. You can use the reactions as I'm introducing people to clap and things like that, or thumbs up. And of course, then I have my friend and my sister in this struggle, Chioma Agbego, who is the founder of TechHer Nigeria and is the executive director. She wears many hats, so I could, again, introduce her forever. But I just really want to mention that in terms of like the States of Emergency Coalition, she's been critical to that. I remember after the death of Uwa, who was raped and killed in Edo State, we were on the phone just talking about something needs to give. We need to do something. And from that call, she got into action, we got into action, and we started this basically, hopefully re-engineering and pushing forward this movement of the state of emergency. So they're really here today to really have a conversation of what is the status of the state of emergency in terms of GBV. We've seen that the legislators put forward, especially from the House, saying that we should declare state of emergency. We've seen what the federal government has done. We've seen what the governors have also put forward in terms of the state of emergency. A lot of promises were made between June and July. Now we are at the end of September as we're about to enter October and celebrate Nigeria's birthday. It's really critical, and I think the presentation has shown us some of the key gaps and the challenges and what needs to be done. But these are the key people who have been at the forefront of having these conversations around the state of emergency, of addressing what we have been able to see. And so for me, I just really want to tell them thank you for coming, and I hope they can all hear me and are ready. So I'm going to ask the first question to just jump in. I'm going to ask Mr. Akpata-san to please just tell us a little bit, since the Inter-Ministerial Committee has been set up, could you let us know what has been the mandate so far, what has been able to happen so far, and just to give us an idea of where we're at in terms of trying to push forward and addressing sexual and gender-based violence as a country. So are you there? I hope we didn't lose him. Okay, I can't hear him. So since he's not responding, maybe Erelu, ma'am, are you there, ma'am? Erelu, ma'am, can you hear me? Are you there, ma'am? Okay, I see you. Great. Okay. So while we wait for Mr. Opata to come back, because I think he dropped off. I thought maybe he was muted, but I think he dropped off. So we'll just. Okay, ma'am.
Okay. It wasn't allowing me to unmute myself. Okay, right. Okay. So you were asking.
Great. Okay, so we have you.
Yes.
Yes. Yes. Yes, I was just asking that since the governors have declared a state of emergency, what in your work that you've been doing in Ekiti State and in the other states as well who've been pushing for it, especially working with the governor's wife, what have you seen that has happened in terms of the promises that have been made? What opportunities have been taken advantage of, and where do you think we are now, looking towards October, 3 months later?
Okay. Thank you very much, Buki, and I appreciate the invitation to be here this afternoon. And I'd like to thank all those who have worked on this research. Thank you, Chitra, for that presentation. It was very informative, and I hope we'll all get copies. Before I go into responding specifically about what's been happening since the 10th of June, when the Nigerian Governors Forum declared the state of emergency on gender-based violence in Nigeria, I would like to remind those of us who have been following this conversation since last year that I started talking about a state of emergency during our 16 days against GBV last year. Everywhere I went, and I went to a lot of places, in Abuja, in Lagos, at the launch of the Sex Offenders Register, at the Voice of Women's Conference in Abuja, at the Project Alert 20th anniversary in Lagos, I spoke about the need for a state of emergency. There are one or two tricks you learn when you spend time with politicians. And what I've discovered is when political leadership want to draw attention to a particular issue or a situation, they declare a state of emergency. And that enables them deploy political will, resources, and attention to address that particular issue within a given time frame. So whether it's a state of emergency on health, on education, on roads, it's important during a given period of time to declare a state of emergency in order to address it. So I kept saying to myself, if politicians or political leadership can do this for other situations, why not for gender-based violence? How many more women need to die? How many more women and girls need to be abused in their homes and in public? And so that's why I kept beating that state of emergency drum. And it's very sad that it took what happened during the COVID-19 lockdowns with such a surge in violence against women and girls all over the country, as we've seen from the data that Chitra presented, for people to finally start paying attention. Now, I remember clearly storming into my husband's office when the news about the poor girl who was raped and murdered in Benin, when it started making the rounds. I stormed into his office and I said, Mr. Governor, when will you and your colleagues do something about this? And my husband was alarmed and he looked up at me like, what happened? And I showed him the news and he said, oh, this is absolutely awful. And so that is how, and then I called up a couple of my colleagues, other first ladies, who were also concerned about having to deal with GBV issues in their states almost every single day. People might not know that in many states, first ladies get calls every day to deal with one GBV situation or the other. Even though we have quite a number of civil society organizations and women's rights organizations try to deal with these issues, people still think that if they come to us, there's something that can be done, especially if they think you have been vocal or have been doing things around the issue. And so many of my colleagues felt it was time for us to come together and try and do something about GBV in the country. And that's how Nigerian Governors' Wives Against Gender-Based Violence started. There are 21 of us in that working group. We had our first meeting on the 4th of June. And the first thing we did was draft a memo to the Nigerian Governors Forum to lend our voices to the calls for a state of emergency on GBV. And on the 10th of June, the governors declared the state of emergency. So what we did from then on as governors' wives was to develop a plan of action for us to work on in our different states. I'm sure you'll appreciate that we are all at different levels in our states with regards to what space opportunities we have to address these issues. Some of us have legislation, some don't. But we drew up an action plan for us to go back to our states and continue to work on these issues. Now, the action plan that we drew up focuses on a number of areas. One was the need for legislative and policy frameworks where they don't exist to ensure that they exist, especially the VAP Act and the Child Rights Act. The second issue was to do with education and orientation for the prevention of gender-based violence. Another area was treatment, care, and protection of GBV survivors. Another area was the importance of coordinating mechanisms. And then we also focused on the need for community ownership. Without community ownership, we cannot get anything done on any of these issues. And so I'm pleased to report that since we started working together as governors' wives on these issues, and because at the Nigerian Governors Forum, the governors went away from that meeting that they had where they declared the state of emergency, saying they were going to go back to their states to get their state houses of assembly to work on legislation. And those who already have legislation were committed to ensuring more political will. And so since that time, Akwa Ibom State and Bauchi State have passed their VAP Act. Then we have Kaduna, who already have their VAP Act, but decided to put in place stronger legislation, stronger penalties against rape, which we heard 2 weeks ago about castration for perpetrators of rape. And then other states such as Kebbi State, Niger State, Kwara State, Imo State, they are all working on the domestication of the VAP Act, and the bills have gone through second readings, I believe, in all their state houses of assembly. So hopefully by November, when we have the next global campaign on GBV, we would have had the VAP Act domesticated in those states. Now, many of us in our different states have facilities in place to care for GBV survivors. In Ekiti State, for example, during this state of emergency period is when we officially opened our own SAC center, our Sexual Assault Referral Center, which is known as the Morimi Clinic. And in other parts of the country, existing spaces to care for GBV survivors have been upgraded. And in addition to the SAC centers, many of us have shelters as well, whether they are temporary shelters or permanent shelters. With regards to coordinating mechanisms, in states like Lagos State, Ogun State, and I'm glad that my sister, Her Excellency Bamidele Abiodun, is on this call. Lagos State, Ogun State, Osun State, Ekiti State, Niger State, we all have GBV coordinating mechanisms, which include statutory representation on those committees, as well as involvement of civil society organizations. So a lot of progress has been made, but there are some serious challenges, and I believe Chandra has mentioned a number of them. But very briefly, one is we are all overwhelmed with the nature of these cases. And as I go into that, in the issue of the challenges, there's something that Chitra said in her presentation about how little discussion there is in what prevention looks like in a pandemic. Now, for those of us who work on gender equality and women's empowerment issues, the same situation applies to periods of war and crisis. What happens to women during a war or conflict situation is a reflection of the space that women occupied, or the status of women pre-conflict. And so in this context now, if we have so many Nigerian women and girls becoming victims during this crisis, we should ask ourselves, what is the context within which we live? What is the context of our lives? Many women and girls are poor. They don't have access to education opportunities. They don't have access to justice. Maternal and infant mortality rates are high. They have very poor negotiating power in their personal relationships. So when we are forced into an intense crisis such as COVID, of course this is going to happen. So in order to untangle that, we need to go back to basics. We need to look at what it means to empower women holistically in our communities and the role the government needs to play around that. So that's a big challenge for us, addressing the root causes of women's disempowerment and women's voicelessness and lack of opportunities to assert their personhood. Another challenge has been, even though we know that many governors are keen to get some of this done and to fulfill their promises with regards to the state of emergency, the pace of lawmaking can be slow because we have to deal with members of the House of Assembly who probably have different agendas and different understandings of what urgency is. There's the issue of lack of coordination and partnerships at state level. That needs to be addressed. And then there are inadequate resources across board. And so in terms of what needs to be done going forward, from our end as governors-wise, we are committed to working on implementation of our state action plans. We will continue to be advocates on this issue at a national level and the state level. As I've just said, in terms of addressing context, we are going to be making the case for the economic empowerment and livelihoods of women, education opportunities for girls, for laws, policies, and resources to address all these issues, and for our state governments to prioritize them. Our state governments need to take gender-based violence seriously and put the resources that are required in place and not continue to wait for donor agencies to step in to do it for them. We will also continue to support women in distress. And we all said we are going to have the equivalent of a GBV Survivors Fund in our state. We have one in Ekiti State as part of our GBV law, but we've agreed as governors-wise that we are all going to have one in our states to support women in distress. And as governors-wise, we'll continue to work in partnership with civil society and donor agencies for peer learning and capacity building for ourselves and for others. I believe that this state of emergency needs to apply to all institutions in society. And I'm particularly concerned about security services. The Nigerian Governors Forum have come up with their own declaration of a state of emergency, and they have a roadmap. Where is the roadmap of the police? Where's the roadmap of the army? Where's the roadmap of civil defense? These are the people who make it very difficult for us to ensure that we see gains in our immediate communities. So I'd like to see a commitment to that from the highest levels possible. Again, in terms of ways forward, I'd like to see more partnerships with civil society organizations and development partners. And what we've done in Ekiti State is, Our state coordinating mechanism, the Ekiti GBV committee that I chair, has civil society organizations, 6 of them on it. But in addition to that, we encourage the civil society organizations to also organize separately so that they can provide effective advocacy and frontline services for GBV survivors. And then I think I would like to support the call from the findings of this research for monitoring and documentation of best practices, for more solidarity and more learning across board. A state of emergency means a commitment by the political leadership to do what needs to be done with a sense of urgency. A state of emergency means a commitment or deployment of the needed material, technical, human, and financial resources. And a state of emergency means just that. This is urgent. This is an emergency. The lives of women and girls and the handful of boys and men who might be affected matter. And I hope this is something we can all work together on. Thank you very much.
Thank you so much, ma'am. I think you went above and beyond in terms of being able to share, starting from last year and up until COVID and this new reality that we have. And in terms of being able to actually make the state of emergency a meaningful process and something that actually leads to change. And I think it's really important to hear you say that action plans have been developed, because I think that is an advocacy tool for all of us to be able to tap into and make sure that our work fits into that, especially as civil society. And what really stood out to me is you capturing the idea around prevention, which is addressing the root causes, and about holistic empowerment, because I think for now we've been so focused on the response that we haven't even really had time to have conversations around prevention and empowering women and girls especially. I think it's really important what you mentioned around the roadmap for law enforcement, because we all know how much police has been the bane of our existence in terms of addressing this issue, and mentioning the military, mentioning, you know, other law enforcement agencies. And I think a roadmap for that, I think, is another critical area that you've really highlighted. And so, but please, Ma, I will come back to you for one more question, but I want to jump to Chioma from the state of emergency. And Chioma, I just wanted to ask you that in terms of this state of emergency movement, and in terms of trying to push this work forward, and in terms of what could be next steps, you know, you and I have discussed the fact that Nigeria is going to be turning 60. We need to use this as an opportunity to drive momentum. So I'm just curious, from your perspective, what you see as the potential to be able to move this forward. And as Erelu said, you know, civil society needs to be part of this conversation and needs to work together with the governor's wives. But I'm curious about what you see in terms of taking this from a national to a state level movement, and what you think we can do for moving this forward, so we're not just only talking about the challenges. Chioma, let me see. I think you're there. We just need to ask you to unmute. Hold on.
Okay, fantastic. Thank you very much, Buki. Good afternoon, Your Excellency, the wife of the Governor of Ekiti State, to all the other civil society partners who are on the call, and to everyone really. Thank you so much for being a part of this webinar and the unveiling of this report today. Buki, to answer your question, I believe that where we need to go next is working with partners at state level. As you know, we held a press conference today just to update Nigerians on where we are with the state of emergency movement, on states that have passed the bill since we first started our advocacy in June, on June 5th to be precise. And then, of course, following on from meetings with the Speaker of the House of Representatives, Honorable Femi Gbajabiamila, sending a letter to the Nigerian Governors Forum, engaging the Nigerian Governors Wives Forum, and all of these other movements and stakeholders. Where we are now working under guidance from, you know, veterans in this struggle, as it were, people like Dr. Abiola Akiode. Where we are now is really amplifying the voices of civil society partners at the state level. And I'm sure that people who registered for this event might have seen the question if they want to be a part of the coalition, because there's only so much we can achieve from Abuja in a state like, you know, for instance, Gombe, where I know that Ward C, Education as a Vaccine, and other organizations are working, or in Imo, or in Kebbi, or in Jigawa. And so we thought about what is the best way to amplify the voices of people who are in these states. What is the way to leveraging on lessons learned from other advocacy efforts, for instance, the Not Too Young to Run movement, where we had state level coordinators amplifying, you know, their own challenges, reaching out to their legislators, etc. And so where we are now, we have collated the names of every legislator in all of the states where the VAP and CRA have not been passed. We're currently putting together letters that will go to all of these legislators, signed by civil society organizations, not only within the state, but also from across the country. Now, these letters will go to these legislators led by the civil society organizations in those states under the, I don't want to call it umbrella because we're all partners, like we're all same level partners, but these letters will go to the legislators. We're also activating citizens and getting them to hold their governments to account, their legislators, their councillors, because oftentimes we focus on national, we forget, you know, the various levels of subnational government. So I agree with Irelu on an action plan, and we're trusting that, I mean, she's always responsive, she's always ready to give guidance and offer her support. So we're trusting that as we continue to just engage with partners, we will see not only these bills passed. I think that's very important to mention, that we're not just trying to get bills passed, we're also trying to get these bills resourced, learning from states that are actively implementing, you know, really effectively, like Ekiti State, like Lagos State. How can these other states not only get the bills passed, but ensure that they have sexual assault referral centers, and ensure that they have a body that oversees the activities of these sexual assault referral centers, that monitors what they're doing to ensure to see that services are delivered as effectively and efficiently as possible. Thank you very much.
Thanks so much, Chioma, for sharing that. I think really important. And like she said, I think for us, a big part of sharing this presentation is that we want it to not just be a report, we want it to drive us. And that's why we were here having these conversations, and we wanted this panel discussion, and we brought somebody like Irelu who's committed, and also brought Chioma to say, look, this is an opportunity for us to really get in there and take advantage of this opportunity. Like I really said, she's been trying to do this since last year. Some of us have been doing this work for a while, but you know, we got remobilized again because of what was happening because of COVID. And so for me, and another big part for me is this is also just that I really strongly believe that we have this year to really be able to continue to push this momentum, so we have something that we can deliver on in terms of being able to say, okay, we've passed the laws, you know, we were pushing for the coordination, you know, let's hold our governments accountable, something to really hold them to. But I really believe that we have between now and December to really go really far and be able to do this. So I'm going to ask Irelu one more question. Since we have her here, I want to take advantage of that. But if you do have questions around the presentation, around the reports, for Irelu, while we have her here, for Chioma, please raise your hand or put it in the chat so we can take advantage of the time, because it's 1:12. We're going to finish exactly at 2 because I respect people's time. But if you have questions, please start putting it in the chat or raise your hand so we can call on you and get it. So Ireluma, my really big question to you is, because you've seen this from the various different perspectives, ma'am. One, in what ways do you think we as civil society can really, you know, push our governments and build really stronger relationships and networks to be able to work together as a partnership? Because Ma, as you know, you're one of the few and a few others who are really receptive to hearing civil society and not feeling like we are trying to push your work down or that we're antagonists in a story, but rather that it could be a partnership, because this is such an important issue. So I'm just really curious, Ma, in terms of the recommendations we're putting forward in this report that matches what it is that you are planning to do as well. How do you think across the different states, not just Ekiti State, civil society can really mobilize? I know there are different coalitions that are being formed. How could they really partner with the government, with the governor's wives, with the different ministries, with the different agencies to actually ensure that we have an agenda that addresses gender-based violence? Oh, you're muted, ma'am. Okay.
Yes, the host is not allowing us to unmute ourselves.
Sorry.
Right, okay. Well, I believe because my natural home is civil society, my first inclination is that this is a conversation that civil society has been having for goodness knows how many years. And as a friend of mine joked, I am an activist masquerading as a first lady and not a first lady masquerading as an activist. I think I got a bit tired of saying the same thing over and over, of marching. I still march, but I was in Beijing 25 years ago, and I'm particularly prickly this year because it's 25 years post-Beijing, and all the conversations and issues that we were raising then are what we are still addressing now. So as someone who straddles both civil society space as well as government space, what I can say is we can't get any traction on these issues if we don't work together. I know what can be done if we have effective partnerships with government. And so I would like to appeal to civil society organizations, specifically the many women's rights organizations who keep struggling on these issues with very little resources, to work in partnerships with their government. And there are certain things you can bring to the table that the governments need. You can bring data, you can bring research, you can bring skills in terms of an understanding of how to frame these issues, how to do the analysis. And also, since we are saying that governments need to take responsibility for addressing these issues without waiting for a donor to show up and fund it, then I think civil society organizations need to be very proactive in terms of guiding their government about how they can deploy resources. And I'll give you an example. Now, this is my activist hat on now. I keep my ears to the ground in the state when I know that the state is about to start new initiatives or new funding is coming in to do certain things. And I ask questions. How are women going to benefit from this? How can you mainstream gender into this to ensure that even though it doesn't address GBV specifically, it's at least to help address women's economic empowerment and livelihoods? So we need CSOs to be vigilant and to be alert and to provide guidance and support to governments to be able to do this. Now, for those of us who are members of the network that I coordinate, the Nigerian Governors' Wives Against GBV, the Nigerian Governors' Wives who are members of our network have all agreed that they'll make themselves available to civil society organizations in their states, because we all understand that there's a lot that you bring to the table that we need. But I think we should try as much as possible to work together so it's not an us or them, because there's a lot that government can do to push this agenda forward. But we can't do it without the active support of CSOs, because whether you have a government in place or not, it is CSOs who are at the forefront of providing services and support for GBV survivors. And without them, they would have nowhere else to go. So we need a lot more synergy. And I hope we see that going forward. And that's why it is a firm part of our action plan, both in Ekiti State and in the other parts of the country where our first ladies are active on these issues.
Thank you so much, ma'am. That's really, really helpful. I think we will reach out to you and get the list of the states so that we can share that with everyone who participated in this meeting, so we can try and key in into that action plan. I think that's one critical thing that we're taking from this. And I'm even wondering, man, let me leverage on the fact that you're here. And as you know, us activists, we always, want to push for a little bit. If you think that it would be good for us to come and present this paper, this report to the other governors' wives as well, to come and present to the network, maybe they would be willing to at least listen to us. Let's share this information with them, and then be able to say, like, let's find ways to amplify and connect what they're doing and share that with civil society as well. So I don't know if that's something you think could be a possibility, but I think we would welcome the opportunity to at least present to the other governor's wife through an introduction by you, so that we can continue to make sure we use this report as an advocacy tool. So you can let us know what you think, about that idea in particular for that. So we will follow up on.
Yes, Buki, that's absolutely fine. We can even do better than that. We are planning an event during the 16 days of activism, a policy dialogue with governors and governors' wives. And so it would not be a bad idea if we have this some parts of this conversation there for you to present this report, an abridged version of it though, because it's an event that's going to be done within a very short space of time. So, and that will be helpful. It will be helpful for the governors to hear and for the first ladies to hear it as well. But I'd like to advise that as you present the report, please acknowledge that a lot of good work has been happening, because government officials or politicians also like people to know that they're not just sitting there doing nothing. So it would be good to acknowledge that things have been done.
That is very noted, Ma, and taken into consideration. Thank you so much. We really appreciate you being here. So I don't know if you still have time for us now. We're going to try and take a few questions and comments if you're still going to stick around, which we hope you will. The first person I'm going to take for comments or response to the conversations that we've been having is Dr. Abiola Akiyode, who we all know and who's been critical to this work and has been very supportive of all the work that has been happening. So, Dr. Abiola, are you there?
Yes, I am. Okay, I didn't know it's going to be this quick. All right, thank you very much. And I want to thank Erelu for very excellent intervention. We always continue to rely on you. You are a great mentor. I want to also thank Choma and Buki for putting this together, and most also, my picture is not showing well. Let me go off it. So I want to thank Choma and Buki for the leadership that they are providing for this movement. I think this is quite noteworthy, especially because for us, for me in particular, I've been here for a while, for the past 20 years or thereabouts, trying to push things to happen. And for them to be leading this, it's something that I will continue to support, just as we always get support from Erelu, Late BC, Fayemi, Obie, Uwanko, and a whole of others, Ajia Sadatu and others. I've listened to the conversation, and I think that Erelu had actually taken a whole lot of the way to go on this issue, which I think it's quite important. I like the whole idea of empowering women and girls, because the truth of the matter is also that if we don't deal with economic empowerment or address the political economy of GBV, that might become like a challenge, for us in even addressing the issue. We have seen quite a lot happening, and I want to commend the governor's wives. We have never seen it this way before. We have seen a lot of collaboration and contribution. I have had opportunity to work with Beyond Working in Ekiti, which is like a home where we get everything done. I have had the opportunity of working with Ogun State's First Lady, and I'm very also happy that she's also here listening to this conversation. They have been able to push for a state action plan, after the state of emergency, likewise Osun State and Lagos State. So a lot seems to be happening since the COVID-19. And so in a way, COVID-19, it's bad for all of us, but it has also created opportunity for us, to push things to happen. On the state of emergency coalition, which I think it's important, I just feel that moving forward, there seems to be an agreement that civil society should work under that coalition. We have, I won't say use, I'm sorry to say used to, because Ekwe is here. We have LACVAL that is actually working around legislative advocacy. So my own point is that there's a need to link some of these groups together so that we're not working in silos. I think that one of the things that can help us to achieve what we want to achieve, it is the partnership. I know that there has been a lot of conversation on the Womanifesto platform, and just as Erilu said, in November at the Womanifesto meeting, if you look at the Womanifesto document, which we'll be sharing more also after this meeting to a lot of people that have attended and all of that. Yeah, one of the issues there is also the declaration of state of emergency, which was part of the speech that she made at that meeting. So which became one of the strong demand under the GBV arm of the Womanifesto. One of the things that I feel it's very important in terms of going forward. I'm also very skeptical about not politicizing sexual and gender-based violence. And that's why I think that it's important for us to hold the government very accountable so that it doesn't just become like statements of action and there's no implementation. So far, there has been implementation in several places, but I think that they still need to do more. Just like we say in the BBOG, what are we asking for? We're asking for more results from government and will not stop until when these issues are resolved. One area which I think that we need to focus on now more than ever before is the issue of resources. I'm sure that maybe some of us know that the cycle for budget in Nigeria starts around September. So for me, it's a good time for us to move the movement forward beyond demanding for states to pass the VAP law, which is a continuous demand that we continue to ask for, but a general call by all the states to ensure that they add concrete budget, even at the national, create like special funds, as was mentioned earlier, to address the issue of SGBV. If they don't do it in 2020, 2021 budget, what it also means is that we have very little, in terms of achievement of what we need to do. From the Womanifesto movement, we're thinking that this could be like a follow-up of this meeting where we all also come together and look at what we can do. Maybe also the coalition that is working on GBV can continue to press that as part of it so that we're not having people doing different things. But so the point I'm raising is that there's a need for partnership at all levels. We cannot achieve anything in silos. It's important for this movement and the other movements to link together. And there is a link also between this and the issue of political participation. I was at the International on Accountability yesterday, and we heard what the minister said. The Minister for Health said openly that the issue of COVID has nothing to do with gender. So meaning that while we're gaining some, there are still some other people that we still need in the government to move to our side to be able to understand that we need to have a very holistic approach to gender issues. So I think the work plan that has been proposed by Chioma, it's quite expansive. Link it with what the first ladies are doing, then we should also link it with what other movements are also doing, particularly the Manifesto movement, where all of us also belong to. The charter that we all put together, and all the policy that we have. So I want to commend Chitra. I have read the report, and I was also lucky to be part of those that she interviewed. But maybe, Buki, my other suggestion is that there seems to be a lot happening. Maybe there's also a need for us to have a basket where we put all of this into, and I think you and Chioma, you are in the best position to put this together, so that maybe by the end of the year, we can come back and look at what gains we have made and where we still have challenges and how to move on in 2021. Thank you very much.
Thank you so much, Dr. Biola. Always great to have you part of this meeting. And we were part of the meeting yesterday that Dr. Biola was talking about, in which he was on a panel with the Minister of Health, who was saying he doesn't see the issue about gender and COVID, which, Dr. Biola managed to keep her cool and be able to shed some light on that. But it was definitely an issue. So it brings back to light, like she said, what we're talking about here. I really agree with what you're saying in terms of linking all of the works together. That was also a key part of why we wanted this meeting not just to be the launch, but to kind of be a conversation space and a platform to connect the dots of all of the work that we're trying to do. Because we know that this work, we cannot do it alone. That's how advocacy works. And so that's why we think it wants to do. So for all of you who are here, we're definitely going to be following up with you, like we said, in terms of the state level work. But I really want to bring up what Dr. Biola said about this budget and in terms of the special funds. Because if we want resources to be targeted towards this, because we don't just want the bills to be domesticated, we're seeing what is happening in Ekiti State with commitments and money being invested. A SAC, a Sexual Assault Referral Center, has been set up. The special fund has been set up. Those are critical. We've seen what's happening in Lagos with the SACs there as well, and with the commitment from the government and the coordination with civil society. So I think really it is in the different states that we're working in. For those of us who are based in FCT, what are the budget processes for those in Gombe, Imo, and I know I've seen from different states, from Ondo, all of it. Is this something we can all key in together? One is this action plan that had been developed by the governor's wife, how we can key into that. And then the second is how we can ensure that resources, apart from the work we're trying to do around domesticating, how can we ensure that the resources, in terms of the budgeting, can actually benefit, right, and speak to this work? So I think, you know, I would welcome thoughts on the chat, or people who want to raise their hands and share some thoughts around that in particular. I just really want to read out some of the things people have put in the chat. For Kriya, thank you for being here. You mentioned that we also need to ensure that bills that are passed are not counterproductive and does not endanger victims further, which is why we all need to be part of the processes of making sure we review the bills that are being put before legislators or that the governors are introducing. That is really critical for us and really important. Martin Mary, great to have you here from Kids and Teens in Ondo State. The need for capacity strengthening of some first-line responders cannot be overemphasized. I came across a responder that got stalked by the parents of a victim and joined in victim blaming, claiming she's a mother. So victim blaming must be abolished. Really important. And Chitra mentioned that she completely agrees. There are too many health workers, police officers, and women activists who still engage in victim blaming and stigmatization. She spoke with a doctor a few months ago who told her that she had asked an eight-year-old girl why she had not thought of the adult man who raped her. So, you know, that's still an issue that we as civil society must come together on. And Matimeri was thankful to, I don't know what BGIF is, who facilitated capacity strengthening done in Ondo, Ekiti, and Oshun, where over 110 responders were trained by Kids and Teens on psychological support and counseling skills for SGBV victims. So the issue of training was raised. Bushra mentions that there's a need to critically look into the monitoring of the implementation of these laws so they don't just pass. are some glory we achieved without much effect in the states? How are perpetrators being prosecuted daily in the states so far, despite having laws in place? Akim mentioned, I'm thanking Dr. Biola about the points on the budget. And annually, really, I think it's an important question, and I don't know who's willing to answer that. How can we maintain the momentum daily because the energy fluctuates? So it's an important question, and people can be willing to answer that. For those who are typing messages, if you want to speak, raise your hand though. Okay, there's that. And then Busha also mentioned that at a recent event on GBV by Spotlights, some lawmakers and politicians were in attendance, and the Minister of Budget and Planning mentioned funding women and girls issues from CSOs and international organizations without showing commitment to it. So they need to prioritize it. There's also a need for energy of GBV in our media spaces. That's very important annually, and I think we need to do more around that. And then working together as communities to fight off GBV in terms of training and retraining law enforcement agents on how to handle GBV cases. What plans are being put in place for that? So those are just some of the questions that have been put on the chat and some of the comments. I'm opening up the floor to anyone who's interested in sharing, or who's from different states who might be willing to share what's going on in their states, and who are interested in sharing what they think they want to carry forward and how they think from this conversation we can help build support, because we know of different groups, like Dr. Biola said, we just know we're all linked. There is going to be different meetings that are going to be happening in different spaces. Now we know of the action plans by the governor's wives. Now we know that there's budget processes that are going to be starting. The Women Festo group have also been doing different kind of work. LACBA has also been doing some work in FCT around legislative advocacy. We are also doing some work as well. As Choma mentioned, we're also going to the states to be sending letters to the legislators and to the governors. So I think it's quite critical for those who are at the state level. If you want to connect with this work and you want to be part of it, now would be the time to share what's going on in your state, what you think are the possibilities, so we can continue to connect the dots. And in that light, I see that Chioma has something to say, so I'll call on Chioma and then I'll call on Madam Miriam. Okay, Chioma, please go ahead.
Thank you very much. Just wanted to respond to Anguli's question on keeping the energy up. I think it's one of the reasons why we decided we wanted to engage civil society organizations at the state level, so that the pressure, number one, is reduced from national, but also because amplifying the voices of people actually doing the work is really, really important. We know that people have, donor reports to fill out, and they are accountable to the people who fund them to do various things. But also there's a critical aspect of this entire work, which is communicating and reaching extended audiences by way of just coming together and pooling our resources together and pooling our voices together. So one way to keep the energy going, I believe that we have a good thing with the state of emergency GBV movement. It is open to anybody in the country, outside the country, to join. The whole essence is just empowering citizens to engage their legislators and their elected representatives to push not just for the domestication of the VAP and the CRA, but also the resourcing and the willpower to actually make things happen. All of the activities we're really involving the media. I think that at the press conference we had today, we had over 40 different media organizations represented. TECCA in its personal capacity has organized, meetups for and experiential trainings for journalists. So we have another 60 of them. So the whole idea is to continue to carry citizens along let them know where we are as far as this work is going on. There's a whole website, stateofemergencygbv.com, where people can continue to engage, get the information that they need. And yes, I think that's kind of where we are. Obviously, we're open to more suggestions. Anglia, I'd be happy to have a conversation if there are any ideas that you have on how we can take this further. Yes, that's really what it is. This is for, like we said today at the press conference, this movement, it's not just a campaign, it's a movement because it not only affects us, it affects our children, it affects our friends, etc., etc. Thank you.
Thanks for answering that, Chioma. And really, if there's any time you want to jump in, please let me know, because we'll always welcome your knowledge. Madam Miriam, please go ahead.
Yeah, thank you very much. I just want to thank Chitra for this report. I think it's very good at this time. I want to say that in Enugu State, the Violence Against Persons Prohibition Law has been passed, but they are still in the process of gazetting it. However, under the Women's Voice and Leadership Campaign, WeNet, WACO, and WEBI are doing some work here. And we have some messages. The important thing is that awareness is being created. People are getting to know that this law is in place. And there are community dialogues which WeNet is organizing, in the communities to involve men and other people in ending sexual and gender-based violence, in the society. So the important thing is that the conversation is on, enlightenment is going on, people are getting to hear about it, people are getting more aware, and people are getting to know that it is wrong to do some of those things that they are doing. And I believe that as the campaigns go on, we will have some, success stories to share. Thank you.
Thank you so much for sharing what's going on in Enugu State. Definitely one of the states where a lot of activities are happening. And I think it's great that we do need to build awareness and momentum around that. I actually just want to also recognize some of our partners who are around. I want to thank Mr. Abraham from the Gashe unit of Ministry of Health for joining this conversation. Thank you so much for being here with us. We really appreciate your continued partnership, because this is also critical to the work that you're doing around adolescent health. So we appreciate you for being adolescent health champion. I also want to thank Mr. Dashe from UNFPA, who also has been listening in. Thank you so much for joining. And I know this is really big on the mandate for UNFPA in many ways. And so we're just really grateful that you could join us and you could be here. So, and I think, yeah, I see a few more people just trying to scroll through there. I think I see a Daisy. I don't know if she's still there. But thank you also for joining us and for always being supportive of this work. So thank you. Really appreciate everyone being part of this conversation as well. I don't know, Matimeri, do you want to share what's happening in Ondo State and what you think this movement can help support? Matimeri, are you there?
Okay, thank you. Presently in Ondo State, all activities geared towards getting the VAP domesticated is still on hold because of elections. Civil societies are doing their best as far as we are concerned to complement the effort of government in the response in Ondo State. But sometimes logistics and some situations, okay, let me just give instances. Ondo State, we have so many local governments that are far from Akure, and there are times that we may have issues in some far distance areas and our numbers will be called. How to get this done without the, let me just say, the political commitment, whether maybe the Ministry of Women's Affairs as a vehicle that we can all put in ourselves with the civil defense, and then we go to do this response. These things are not yet there. But we are praying that if things come to normal, maybe after elections, that we may be able to come together and say, okay, these are the things that we need to do let's emulate states like Ekiti that are nearby, even if it means that the responders are this committee at the state level should go and pay a visit to Ekiti and learn from what they are doing in Ekiti state. So that by the time we come back, we are better off. A number of cases are here that people at the police station, they tell them to go home and settle it because incest between father and daughter, between siblings, are on the increase here in Ondo State. Thank you.
All right. Thank you so much, Martin Mary. So after the elections, kick into gear.
Yeah.
Okay, great. All right. I also want to recognize that I see Mr. Gabriel from UNAIDS. Again, I know this is an important issue also for persons living with HIV, including women. So really glad you could be part of this conversation as well. Thank you for being here. All right, and I see a few people, but I see Mina, you had mentioned some things on the chat, but I think it would be good to unmute you for you to share because you're mentioning that we need more attention to this in the Northeast. So do you mind just sharing a bit? Let's give you a chance to share. Mina, go ahead.
Hello?
Yes, we can hear you.
Hello, can you hear me?
Yes, I can hear you.
Hello. Okay, good afternoon. I'm actually from Adamawa State here.
Adamawa, yes.
Can you hear me?
Yes, we can hear you.
Yes, Adamawa State. Okay, so just last two months, we had this issue where a girl of 15 years who is both lame and blind, and she's been bedridden for 2 years. She was raped in one of the local governments here. Then there's this foundation here in Yola, Debbie Kauna Foundation. They went out to see what they can do about the issue. When they raised this issue, it was just closed down. And then we also had the case of this 9-year-old girl who was raped by her stepfather. Now the lady in question is a police. She's into hello.
Yes, we can hear
Hello?
you. We can hear you. Maybe she can't hear us. Hey, we can hear you. Hey, I think we lost Mina. Okay. I'm just going to read out what she put on the chat. She was just saying about 2 months ago, the 15-year-old physically challenged girl was raped in Adamawa. Okay, yes, we can hear you. Go ahead. I think she's muted. Was raped in Adamawa State. The news died down. A 9-year-old was raped by her stepfather, and there's still a lot of people blaming the mother of the girl for taking her husband to the cell. And so she's wishing there's more attention to what's happening in Adamawa State and the Northeast, because it's very difficult for victims to speak out because nothing is being done about the issue. Yeah, so I think that's very, very critical and really important and something we do need to amplify. So thank you so much for sharing that, Mina. And I know Dr. Abiola is doing some work in Adamawa State, especially around supporting in terms of laws. So I think that it might be critical to connect with her and see what is being done and see how we can push for that. I also see another UNFPA friend, Deborah, who's here. Thank you, Deborah, for being here. We really appreciate you for joining. Okay. So I don't know if there's anyone else who has any questions or any comments in terms of way forward and other things or questions, but I do want to say that if there are any questions that you remember or any comments or in ways that you want to connect with in any way of what we've mentioned, we're definitely open to that. Work is going to continue from this. It's not just a talk shop. So in terms of writing letters to the legislators and to the governors, we're going to move forward with that through the state of emergency. in terms of the idea around doing the budget advocacy, that is also going to move forward as well. So those of you who are interested, please link up. Connecting with the Governor's Wives Network in terms of their action plan, that is also going to move forward as well. And I think it's quite important that for all of us, that we are able to push. Like for me, I'm saying what is driving me and this momentum right now is that we have this limited window in which attention is being paid to this issue. And we really need to move forward with it. We know that all of the ministries are willing to listen to us. Unfortunately, the Solicitor General, the network wasn't working. You know, he had come on a few times and then dropped off, and then he had a meeting. But we're still going to continue to push in terms of the Interministerial Committee in particular. Yes, we can definitely tweet about this event, please, Bushra. Please do. Please share the information out there. And we're going to follow up with all of you, which is why we also had questions for those who were interested and wanted to be part of the state of emergency movement, so we can connect the dots and continue to do that. We promise we will send out the presentation and the reports to everybody because we hope you find it useful and can use it in your advocacy. We would also share information in terms of way forwards and strategies, because we want to continue to engage at different levels to ensure that something is done, that victims and survivors continue to be able to speak out, that those who want to continue to push for laws have a community that they're going to be working with, because we know there's civil society who are already working in the states and who are already engaged, and we want to support that. And we want to ensure that that continues to happen. So from my end, because I don't like continuing meetings just for the sake of meetings. Oh, there's somebody who wants to speak. Okay, Jamina, please go ahead. Or was that an error?
Like the governor's wife, she said something about the state. But what about the local government? Because in some areas, they don't know what they are even doing, especially the remote ones. How can they co-opt some of these local government chairmen's wives into the project so that they can, you know, go into the rural area to tell them what we are talking about, the issue of gender violence against gender-based violence, please.
Okay, ma'am. So you're saying that targeting the local government as well?
Yes, so that it won't be the state alone. The rural people, they are the people that are affected with all this violence of a thing that we are seeing. So we want them to co-opt them into the project.
Okay, ma'am. So I think
I'm from Form 1.
Ma?
I'm from Form 1.
Form 1. Okay, thank you so much, ma. That's an important point, and I think Ere Lubisi would like to speak to that. In terms of what's happening at local government?
Yes.
Okay, ma'am.
Thank you. Well, if you remember, I said one of the key areas that our strategic plan addresses is community ownership. We can't achieve that if we don't work at local government level. So all of us, and let me use it as an example, we have held meetings with the chairmen themselves or the chairs themselves of the local governments, and I've also held meetings with their spouses. The GBV committee that we have at state level is also being replicated at local government level as well. And we are going to have representatives from traditional rulers, religious leaders, opinion leaders at community level who are going to be part of those local government committees. And we also have plans to establish at least 2 additional sexual assault referral centers in 2 other senatorial districts in the state, because the one we have in the state capital, Ado-Ekiti, is in the central senatorial district. So we are going to establish 2 additional ones. They won't be as big as the one we have in Ado, but there'll be 2 resources available in other senatorial districts. And in every local government, I have given directives to the wives of the local government chairmen. In every local government, there should be a safe house or a shelter where we can provide support for women and children in distress. It is not possible to do any of this without putting structures in place at local government level.
Okay, thank you so very much. Let me take advantage. Somebody also mentioned asking if sensitization is in the plan, sensitization around SGBV.
Of course it is. And because, as I said, to go over, in case there are those who joined after I spoke, the 5 key areas our plan addresses are legislative and policy frameworks, number 1. Number 2, education and orientation for prevention. Number 3, treatment, care, and protection of survivors. Number 4, community ownership. And number 5, coordinating mechanisms, ensuring that there's a state coordinating mechanism in place that will in turn also ensure that we have it replicated at local government levels. You cannot, again, you can't do this without putting in place sensitization mechanisms, particularly in local languages.
Thank you so very much, Ma. And Martin Mary is saying the Ekiti State's response is commendable and there's meaningful involvement of civil society in Ekiti. So speaking to your work. So thank you very much, Ma.
Thank you. Thank you.
Okay. All right. So I think we have answered all questions. We have addressed all issues. We have, put a way forward on the table. We are going to be following up with emails to continue this conversation and to continue this work. So please continue to engage with us. And please continue to make it possible for us to continue this conversation and to keep pushing until we get to our goal, which is to get the domestication of the legal frameworks that are critical for this, ensuring that there's support, doing more around sensitization, and really keen into the opportunities to make changes and differences. For those that actually are participating from the US, who woke up very early from the US and Canada to be part of this just because they care about Nigeria, or they care about the work some of us are doing and have participated here. I really want to say thank you. Just shows your level of commitment. I really want to say thank you to Erelu Bisifayemi for consistently always saying yes, even when we reach out to her at short notice. But because this issue is important to her, she's willing to share, and she stayed for the entire time. And so that for me is really significant and really huge. We don't take it for granted, Ma, because we know you're very busy. So I just really want to say, really thank you. I don't know if you have any final things you want to say before we wrap up, in case there were any things that were missed or anything like that. Okay. I think we're good. I want to say very thank you to Chioma Gwegu. We've been working really hard, and she was coordinating the press conference and was able to come be part of this conversation. I want to really thank our partners, Osiwa, through Mikan. Thank you so much for supporting this work. There'll be more policy papers coming. We have one coming out hopefully really soon that's going to be looking at how COVID has affected people. It's going to affect sexual minorities and what that means for that community. We're also going to do one around health, and we're also going to do one around economic empowerment. So there's more to come from this, but we will continue to advocate around this. I really want to say thank you to our partners at TIAS for being consistent and for supporting this process as well. Thank you to everyone who shared, who tweeted, who communicated with us, and Aluta Continua, Victoria Aseta, right? I'm taking that from my pretend to have gone to AU because I grew up there. Anyway, but want to say thank you all so much. Enjoy the rest of the day. And we will definitely share the presentations and the reports with everybody and follow up with all those we promised to follow up with. Thank you so much. Okay, let me turn on a video. Thanks, everyone. We're gonna try and take a group photo, but I don't know how to do that. Awesome, got it. Thanks to those who turned on their cameras. All right, thanks so much, everyone. Have a good afternoon. Okay.
I think there is a hand up.